Hey, friends, and welcome back to the Healthcare Wayfinders podcast, where we are routing you to more accessible and cost-effective healthcare. Today, I'm excited to share my conversation with Dr. Brian Hill, co-founder of HIPnation. In today's podcast, Dr. Hill reveals how HIPnation is revolutionizing healthcare with a patient-centered approach that breaks free from the traditional insurance system. We're going to explore how their unique model combines both direct primary care and medical cost sharing to save money for you, the healthcare consumer, while improving care quality. Let's jump right in. Okay, Dr. Hill, thank you so much for coming on the Healthcare Wayfinders podcast. You have a company called HIPnation, Healthcare Impact Partners. Would love to hear a little bit about HIPnation and what y'all are doing, and then we'll jump into a little bit later kind of the story and background about why it happened. So tell us a little bit about HIPnation and what you guys are doing to transform the healthcare space for patients first.
Patient-centric. Yeah, that's always the key for, I think, anything that should be happening in healthcare is it's got to start with that individual patient standing in front of us. So first, Zach, I appreciate you having me come on to your podcast and reaching out to your audience and speaking about, what we love to do, which is exactly what you're working within your group. How do we find and bring affordable healthcare to people, but also make sure that they're getting quality care along the way. So I'm a practicing physician. I love medicine. And I really come with a belief system that our healthcare, system that's running right now is one that's not patient-centered. It is exorbitantly expensive. And there are way too many people with their hands in the pie of healthcare and not really bringing value. And so
Amen.
The first thing that I want every one of your listeners to understand, and we're going to talk probably about a lot of nerdy things. I'll apologize. I have a tendency to nerd out about a lot of this. But I want them to understand that there are pathways out here through all the nerdiness that we'll talk about where they can get great healthcare at a great price. And our goal is to do just that. So we'll talk about how we can deconstruct the healthcare system and make it really work for people again. But that is our ultimate driving desire, better healthcare at a better price.
That's awesome. I love that vision. Please sign me up.
And it's possible. It can happen. That's the cool piece.
So what is HIPnation? And if, let's say I was just a consumer that signed up for it, what does it look like and what does it do for me and how can I participate?
Sure. I'll start at a 30,000 foot level and kind of answer, kind of walk into that. So our goal within that concept of better healthcare at less cost, really what we do is we attack the healthcare marketplace, that is burdened by a tremendous amount of administrative costs, bureaucracy, complexity, chaos, and as I mentioned before, an awful lot of hands in the pie. And so what we do is we give businesses or individuals two opportunities to engage with us. We've got different products that we sell. We've truly built a unique healthcare ecosystem is really kind of the idea around it. And the two products that we've put together and use in the marketplace is one that's almost a cooperative style of an approach. It's almost like crowdfunding health, if you will. And we just aggregate and bring people together and pool financial resources together and step outside of the insurance world and say, how do we, as a community, help people access healthcare at a better price, which we can talk about? How do we make sure we're getting great healthcare? And how can we make sure that, God forbid, if something bad happens to one of us, right, that we have the capital available to help against those worrisome medical events that is the reality of life. So when we almost have, like I said, a crowdfunding, we'll use a terminology called medical cost sharing platform for individuals and really small businesses that we can take into the marketplace. And generally we see companies and people saving 50 to 60% compared to their insurance plans. So we just don't walk away from that traditional insurance model. It's broken. And then we also have for, small groups and even, we can, do this with groups that are 7, 10, 20, up to 500 in size, where we go, again, walk away from that insurance-based model. Let's create a product where you fund the healthcare for your employees. And we will, in medicine, and our team at HIPnation, partner with you and your employees to do the same thing we do within our co-op. How do we help you access the healthcare marketplace to get the better care at the better price by utilizing our services? And again, always having that backstop, of that one's a more traditional insurance, if you will, having that backstop that, God forbid, I get hospitalized, I have cancer, right? Something bad happens to me, right? We want to make sure we've got the funds available to help manage that. But you and I were talking before, this is, This is a unique healthcare ecosystem mindset that is stepping outside of Blue Cross, United, Cigna, Aetna, Humana, right? These major monopolistic players in the marketplace that are really leading healthcare by the nose and driving costs through the roof.
If I'm thinking about as a business, I normally would sign up for or try to sign up for a health insurance plan for my employees, which is going to be, super expensive for not a lot of care. And then as the employee,
Yeah.
you then, you're given this insurance card and you're told to go find a provider that is in this network. And hopefully, you can get the copays and the deductibles and all that stuff right and somehow come out the other side feeling better. But so what is the process for somebody who's a part of HIPnation, both from like an employer side and then also, the actual healthcare consumer?
Yeah, no, it's great. And I kind of see them one and the same. I tell people, if you build something for the person in front of you, you build something for employers, because
Good.
employers are filled with a bunch of individuals, right? And so let's fix it at that individual level. So I'll walk you through, a little bit of our process and how we function and how we work in the marketplace. And it really becomes pretty simple. I mean, part of our concept here is the keep it simple, stupid principle, that chaos equates with cost. I'll throw this out there before I tell them. It's interesting. I was talking to somebody the other day, and I was talking about, the chaos and administrative burden in healthcare. And they go, I don't see it. What do you mean? I walk in, I mean, I pay huge premiums, right? I can barely afford my premiums, and I walk into a doctor's office and all I do is put an insurance card down on the table and I pay my $75 copay and I walk out, and there's no chaos to it. And it's a great, I won't use the word, we'll use the word, the scheme. It's a great scheme from the insurance side, because nobody understands, what's going on under the surface from the side of medicine, having to deal with the insurance industry, all the bureaucracy, all the costs, all the intermediaries, everybody taking their dollars out of the system. The consumer is completely unaware of any of that. And so going back to the keep it simple, stupid principle, co-pays, deductibles, co-insurance, max out of pockets, we're like, there's a lot of chaos and obfuscation within that. And when you walk in with an insurance card and put your card down on the table to see maybe a specialist, I'm a surgical specialist myself, you put your insurance card down and you pay your $75 copay, you have no idea what the real cost of that office visit is. It's not a $75 copay. Yeah. And otherwise, your insurance premiums wouldn't be so ridiculously high, right? There's a lot of stuff that's going on in the background. And so what we do, is we go, we're going to build a unique healthcare ecosystem that really kind of functions like when I go out and buy my dinner, or when I buy groceries, or when I buy anything else actually in the marketplace of our society. We're going to build a healthcare system founded on two pieces. One, we take primary care physicians, the foundational building block of healthcare, the people that are supposed to keep you healthy and well. And we take physicians out of that overbaked, overexpensive, over-administratively burdened insurance system, where doctors are spending half their time meeting metrics that are based on insurance collection requirements and coding and billing requirements. And they're taking care of 2,500, 3,000 people because the costs of dealing and trying to collect from an insurance company are so expensive that you've got to move so many people through the office. It becomes a volume game. The physicians are burnt out and miserable because they're not spending time taking care of people, and patients are miserable because they just become just part of the cattle being pushed through the office, and healthcare is not happening. Primary care has become an administrative process, is all it's become, of moving people through the office. And so we take that and we go, walk away from that, engage with us, and our primary care docs take care of a couple hundred people instead of thousands of people, because they don't code, they don't bill, they don't dance with insurance, they don't do any of that stuff. They literally work on our platform and work on a very simple kind of almost a membership model, if you will, that we embed into our plan designs. So when an employee signs up, somebody signs up, they'll sign up with a HIPnation doc and they'll have unlimited office visits. They can text their doctor, call their doctor, spend an hour and a half with their doctor who sees 6 or 8 people a day, and actually become a human being and actually have conversations about life and health and wellness. And really with us, and hopefully their employee, focusing on how do I live a long, happy, healthy life, right? So first we built this ecosystem of ours on this undeniably valuable foundation that empower people with access to great primary care and have that primary care doctor partner with that individual for health and wellness. So that's one foundational piece that we just rebuilt our healthcare model around. because we believe that it is so tremendously valuable. And honestly, from my side, I believe people deserve it. I believe they actually should be heard in their doctor's office, right? They shouldn't be rushed through after spending an hour and a half, right, sitting in the waiting room and then sitting in the back office and be just shuttled through. And something's just wrong there. So we rebuilt our model on that first. So long explanation about that piece, but I think in this, again, this is the nerding out, but it is so fundamental and important for people's health and wellness to actually allow them to partner with a doctor and spend time with that doctor and work together to live well. And we've fallen short on that in today's society. So that's one thing.
No, that's so good because it feels like, at least the way it is now or been my experience, I'm just going to the doctor to give me a script and get out of there as soon as I possibly can. I don't really think of them as, a team player in my life and in my family's life on how us to stay healthy and wealthy. So, the vision of what you're talking about is something that feels very enticing, I would say.
Well, we hope so. And we truly believe that that's how healthcare should be. It's why I went to medical school in the first place, right? I went to medical school to not be an administrator for the insurance company and to try to shuttle as many people through my office as I possibly can. You go to medical school and you have that heart and that calling because you want to make people well. And right now the system's not allowing that to happen. And so we can either, one, continue to work in that system and complain about it, or we can maybe build a new ecosystem that actually allows us as physicians to engage with people in a way that's meaningful. Right. So that's one foundational piece with
Cool.
us.
Is this like a direct primary care model? Am I right in describing it like that?
It is. So yes, for those of you who don't know the direct primary care, kind of that Zach just mentioned there, this is part of the revolution that's going on in healthcare, which is fun. That physicians in the primary care space are going, I'm walking away from the insurance world. I'm going to set up a shop. I'm going to take care of my local community. I'm going to love on the people that take care of me. And I'm going to work for you, not for the insurance industry, because you pay me, not Blue Cross, United, Cigna. And all the administrative costs fall away, all the chaos falls away, and it becomes a much more pure-based approach to healthcare. So yes, we've embedded that as one of the foundational pieces in our ecosystem.
Okay, so I've got unlimited access to my primary care doctor who, realistically should be able to manage 80-90% of my healthcare. What do I do if I need to go see a specialist like yourself? What's the process like for somebody who's a part of HIPnation?
Perfect. So our next segue, and all of this, again, falls within our two different kind of models that we work within. I'll reference this within the employer-based model that we use on our kind of self-funding plans. So if somebody needs to go out and see a specialist, we want to maintain the same concepts of economic efficiency, price transparency in the marketplace. We think those two things are tremendously valuable. And we also believe in helping people. So if somebody needs to get referred out of their primary care, where they have that great access to a doctor focusing and advocating for them, we now have a care team that's going to take that individual and say, okay, your primary care doctor refers you out to see a cardiologist. Perfect. We're going to take your hand and we're going to walk into the marketplace of healthcare because it's chaotic, it's a mess, right? Let us help you. And so our care coordinator is going to connect with that member of ours. We're going to schedule an appointment with a cardiologist. And the way we function in this piece of the marketplace, is in a very price transparent, competitive, economically efficient way. We use a very simple mechanism. It's called buying healthcare services directly from the cardiologist. Same way I go out and buy dinner. I'm not going to walk in and have an insurance card that I'm going to slap down on the table with some random copay that activates, again, all the chaos that people are completely unaware of, but that's 70% administrative cost to collect money, right? I'm not going to activate that process in that cardiologist's office. What we're going to do is we're going to have our member walk in and we're going to help facilitate this and literally buy that service directly from the cardiologist at the point of service.
Wow.
And we just do it as a self-pay customer. And we have plan designs that we build that are deductible only plans, no copays, right? We don't want things hidden from the real price of care. So I would say a common plan that we have employers go with is $1,000 deductible. So if that employee walks in and needs that cardiologist office visit, they're going to buy that office visit with their credit card. And they're just going to buy it as a self-pay customer. Again, we'll help facilitate that. And the beautiful piece of this, again, physician-built mindset. And some people know this. I'm finding when more and more people are realizing this. When you buy services directly from medicine, without it passing through the bureaucracy and administrative costs of insurance, the medical community will discount the pricing
Mm.
significantly. You get rid of my collection costs and you pay
Yeah.
me today. What a great thing. So the employee will pay the point of service. They'll pay for that service. They now are in a price transparent way. They know what the cost is. If we have a cardiologist that wants to charge twice as much as another cardiologist without providing a better care or a better patient experience, guess what? That cardiologist is charging twice as much. We know, and our members know. And now that cardiologist is going to either have to have one of two things happen. They've got to actually improve the quality of care they're delivering, or they're going to have to drop their
Hmm.
price, right? We're going to create this true price transparency in the marketplace to improve the quality, the value proposition of healthcare, which is sorely lacking in today's world. And we're all about quality. I want people to get great care. So our member will pay directly at the point of service for that cardiologist office visit, apply that toward their deductible, right? Buy healthcare at its best price, right? We not, but then allow it to go against their deductible. Whereas insurance plans, if you're on a Blue Cross United Cigna, right, you can't put that against your deductible if you buy it as a self-pay rate. You've got to use the insurance scheme in order to apply a higher cost to your
Yeah.
plan. And then if the employee gets to the point where they see the cardiologist, they have an exercise stress test, we find a cardiac abnormality that requires an intervention. As that employee is walking through it, buying the services directly at the point of service through their credit card, and they hit their $1,000 deductible, with our care coordinator walking with that individual in hand throughout the entire process. And that individual needs a cardiac ablation. They need a stent. They need some other surgical or intervention done. When they hit their $1,000 deductible on that plan, what we then do is we're not going to do anything different. We're still going to present as a self-pay customer. But what we're going to do is we're going to put a virtual credit card on that employee's phone, have that credit card directly tied to the claims fund for that employer self-funded group, and use that claims fund to now buy that service directly from medicine, again at its lowest price point. Right? Economic efficiency in payment at the point of service without having that medical community waiting 90 days with 60 to 70% collection costs fighting to get paid. Buy healthcare efficiently and transparently and allow us to buy it at a better price. And when we do those things, when we function in this marketplace, we find that the underwriters, and we put a reinsurance carrier around that plan for that employer group, so that if they, God forbid, have a terrible medical event, they know that this is a more effective way of getting people better care. 80 to 90% of their care happens in this primary care space. Healthy people are less expensive people. And then if they go out and have to have a medical services outside of the primary care, we're buying them at a better price. The premiums on this now, right, are significantly decreased compared to a Blue Cross United, Cigna, Aetna, Humana insurance-based plan. Smarter healthcare at a better price.
Wow, that's awesome. I'm thinking, I've got a lot of questions. I'm thinking that, obviously these specialists have to believe in your mission to want to participate. Can any provider, even if they also take insurance, can they join your model? Like, my wife's a nurse practitioner in an endocrinology practice. She sees folks on Medicare who are managing diabetes all day long. Like, can a practice that is also doing things traditionally partner with you, or are these like direct primary care specialty practices?
No, that's a great question. So this is any specialist, any hospital system, any ambulatory surgical center, any imaging center. I mean, one of the beautiful things, and the reason we built it this way, is everybody has self-pay
Mm-hmm.
rates. So cash is king in this world. And so it's not like it's a unique or new thing that we're stepping into. It's already an ecosystem or part of our pricing mechanisms built in healthcare. And so your wife, as a nurse practitioner working at the endocrinologist, they have self-pay rates. And so it's just an efficient way to get paid. And so we're just accessing that marketplace. And by that, you mentioned kind of the network concept. The beautiful piece of this is we get rid of any of that concept of network. What becomes the network, if you will, right, is a price transparent self-pay marketplace. And now we're purchasing services in a transparent way based on the value proposition of cost and quality that's being presented to us. And we're just helping our members navigate and become smarter consumers in healthcare. Like, you work in labs, and the pricing in the labs that you're able to bring into the marketplace. Are the labs any less value? Are they any less quality when you're buying them at a better price?
Same national laboratory testing company.
Yeah, no different. But people are overpaying when they don't work with you, and that they're buying it at a better price when they work with you. Why not work
Yeah.
with you? Same thing with a specialty office visit, imaging centers, ambulatory surgical centers. And just because we got rid of the fat in the middle, it just allows us to purchase it in a more efficient way without the burdensome of insurance on
Yeah.
top.
No, that's awesome. You mentioned, I feel like you mentioned some type of like a care coordinator or somebody like that who's helping the people navigate the process of like going to the specialist and then managing what happens when they meet their deductible and stuff like that. Can you talk a little bit more about that? What type of support there is there?
Yeah, and I will tell you, it's interesting. I think outside of our primary care, I think that is one of the most valuable pieces that we bring to the marketplace, because it is really, healthcare is a mess. And Lord help us, we're hoping. And you said you'd be, pushing against that brick wall when we spoke earlier. Healthcare is a brick wall. It's tough, and so we believe that people need help along the way. And so what we do is we bring that care. It's almost a kind of direct primary care concept, if you will, of helping somebody walk through that process. That once you leave our primary care physician's office, we don't stop there. We're going to assign and have a one-to-one person working with that individual to navigate healthcare outside of it in this new ecosystem mindset. And so we want to be there. We have a technology platform that we engage with our members on, that we can work through texting and phone calls and help our members just, like I said, simply navigate through the specialty office visit, the imaging centers, the ambulatory surgical centers, hospitalizations, and work on, helping people really, again, become a smarter consumer in healthcare. And that's what we need in today's world. We shouldn't have people going out and buying an MRI for $2,400 when you can buy it for $400.
Yeah.
It makes no sense to me.
Oh my gosh, that sounds so helpful. We recently had our son was born back in May, and we have a health share, which is kind of similar to what you guys are doing. But I still have to be the one that reaches out to the hospital and say, "I'm a cash pay patient. What's your cash pay price?" I mean, it's still difficult. Like, it took me over 2 months, I think, before I could even get the hospital to tell me what our bill was going to be for my son's birth. And thank God it was super simple. We were only there one day and then we were gone. But having somebody there, again, almost like another player on your team to help you with your interactions with sort of the traditional healthcare environment. I mean, I could see that as such a huge value for somebody being a part of your membership program.
Oh, thanks. And it is, and it's necessary. And it's actually, right, a really sad statement about the healthcare system that it took 2 months for a hospital to tell you how much it was going to get charged for a simple delivery. You walk onto a car lot and you see the pricing posted on the cars. You're paying less for a hospital delivery for a baby than you are by a car, and yet they can post pricing for a car. It is silly how healthcare works. And part of this really is going to become a necessity from my perspective, that if we're going to solve this problem of continually rising costs, premiums going through the roof, unaffordability in healthcare, people becoming bankrupt because of healthcare expenses, we're going to have to truly come together and go, we're going to have to grind through this process together. We're going to have to create force in the marketplace to push hospital systems and imaging centers, and imaging is pretty easy, to be honest with you, but we've got to push the healthcare marketplace toward one of price transparency and competition, and really, right, a positive customer experience. And it's going to take some work to get there. And that's part of why we have the care team. But I think it's a sad statement that our healthcare system sometimes isn't as transparent as it needs to be.
Yeah. I think everybody has experienced that, getting some type of service, not knowing what it's going to cost, getting a bill, living in trepidation to get that bill, weeks later is just a feeling that nobody wants to deal with.
And we don't buy anything else that way, right? We buy nothing else that way. Why have we become so accustomed and so willing to accept that in healthcare?
Yeah, I want to talk about the structure, because I feel like you're going to have some insight on that. Before we do, just tell me again how, you said if you build something for an individual, you build something for an employer. How does this work? Similar situation for somebody who's, I'm a business and I want to sign my folks up for that membership because this way they're actually going to get care. What's the process there?
Yeah, so usually what we give a couple different options for an employer. Always give them the option that if they just want to bring our primary care component alongside their traditional insurance plan, we can do that. And we can just, if they want to dip their toe in the water to see what it really means to have great access to great care for their employees, can always do that as a bolt-on. My recommendation generally is kick that ecosystem aside, right? Completely get rid of that and embed a more effective approach like we do as a whole. And so what we'll do in that case is just like any, kind of traditional product out here, we'll get a census of their employees. We'll take it to our underwriters. We'll get a quote from our underwriters based on AI, artificial intelligence underwriting of the health risk of the group, get a quote put together. Our underwriters are going, we understand and realize that HIPnation and your care team approach is going to provide better care and you're going to buy healthcare at a lower cost. So we get decrements on the premiums from our stop loss carriers, but we just say, give us your census, we'll quote you out. And then we have a team that literally walks that employer and their employees through understanding this, enrolling in this, engaging with your HIPnation primary care doctor, and then partnering if you need to walk outside that office.
That's interesting. That seems like a super easy process. It's not part of the traditional insurance system. Is what you do compatible with like if a company has like an ICHRA or Coursera? Are you familiar with those programs where you basically you don't have your employees signed up for an insurance plan, but you contribute a certain amount of money tax-free to those premiums and stuff? Does that have any overlap with what you guys do, or is it sort of just a separate, the company pays for this membership to HIPnation so that the user doesn't actually have to use their regular insurance?
Yeah, so with an ICHRA or Coursera, they have to be identified and be utilized within a traditional insurance-based plan. So most companies, if they're using kind of an ICHRA, based approach, they're giving employees a fixed amount of dollars, and then those employees are going out into the marketplace and trying to buy, a traditional insurance plan, which classically is going to be an Affordable Care Act. I use the colloquialism Obamacare plan. And now they're out there, unfortunately, purchasing healthcare in a really expensive marketplace with a little bit of a subsidy from the employer. But the employer is just trying to step away and go, I can't keep up with an $800 premium from Blue Cross or a $900 premium from United Healthcare. So here, I'll give you $300 and just go out there and good luck on your own. And I'll tell you, and you probably know this, employers, and we work I love the small group market. I love, like, my sweet spot is really like that, 10 to 125 employee size. It's just, you can talk to the owners. They love their employees. They really care about putting dinner on, the money and into their pockets, dinner table conversations. It's really special. And so we want to walk into those employers and go, you can stop actually giving people an ICHRA and having them go out and fend for their own to buy terrible products with crazy high deductibles that very few people take, and actually let us come in and drop your premium by self-funding with us. Make sure all of your employees actually get great healthcare because your primary care comes completely free with us now. All your office visits, unlimited care, right? Cell phone of your doctor, all of that is included in your premium. So as you mentioned, 80 to 90% of your care now comes at no cost to the employee, and it's great care. And if they go out and they get sick, the deductibles that generally we can put together on our plans, the financial liability, if you will, for the employees are so much less because we're purchasing healthcare at a better price that it's just a better solution than kind of that pop off, almost ICHRA, if you will. And this allows the employer to really look around the table, look around at their employees going, we're doing this together, right? We're a family putting money in a pot together to help manage our healthcare spend together. And it's really a great retention and recruitment tool for those employers. And it shows that they care for their employees. So I generally tell them, walk away from the Coursera, walk away from the ICHRAs, let us come in and self-fund you and actually really bring a really great product to your team.
Yeah, that's a really good explanation. I appreciate that because, as somebody who's a business owner who maybe can't afford a company plan, but is still wanting to do something to contribute to your employees and help them access better healthcare, I feel like you just gave a perfect argument for why, hey, just jettison the whole regular insurance system and work with HIPnation or a company like you guys, because the employees are going to get better healthcare and it's going to be cheaper, right? Better healthcare, less cost, as you guys say. Yeah.
Why not? I'll throw one other thing out here at you, Zach. And it's interesting you mentioned that you're on kind of the medical cost sharing platform yourself. And I'm actually on that. I'm on a medical cost sharing as well. I've just been on it for a long time. I love it. I love the group that we work with. And for those really small businesses, and especially the ones that when I say that if they're price sensitive, and by price sensitive, I mean, we've got some very high net worth and companies that make with employees that make a lot of money on our medical cost sharing platform. I tell people they look at value propositions. I like our medical cost sharing platform for small groups. It is a tremendous, I mean, again, 50 to 60% cost savings. It's not an insurance product, as you know, it's a non-traditional, non-insurance product. But man, we can be very innovative in that space. We do again, we still have a care team that helps those employees if they need to go out and see specialists and things like that. So they're not out there on their own. We still kind of maintain that same mindset around helping people. But I love it. It's actually where we first moved into with HIPnation, is in that medical cost sharing space. We built these self-funded plans later. But conceptually, people coming together as a community, helping in each other's healthcare spending, buying healthcare services directly from the marketplace, right? It's everything that you really want it to be. I enjoy that as an adjunct and part of what we actually sell as well. I'll throw this out there. I love stories about groups. We've had a group that had just 15-person company, small company, and they were on, and I don't know if I get yelled at for talking about insurance plans, but they were on Aetna, and they walked away from Aetna and joined us. And they had 4 people on their plan with Aetna, the 2 foremen and the 2 owners of the company, and because nobody else could afford it. And we brought in with our medical cost sharing, the employer paid for all of their employees 100%, for that. All their employees are now on a medical cost sharing platform, great access to primary care. And the company still saved $12,000 compared to what they're paying for 4 on Aetna, right? So when we talk about access to healthcare and the problem in our society about people not being able to get in to see a doctor, bankruptcy in healthcare, we just in one simple, small, awesome little company, we took 11 people out of that and brought them great access to great care. And if we can multiply that right in all these communities around here, what a wonderful thing we can do for society.
Yeah. Oh my gosh. I want to go so many different directions here. And I definitely want to highlight, your personal story in this. One quick question, over the past 10, 20 years, we have seen, healthcare systems buying up doctors' practices. Basically, you have your healthcare system, it feels like, in your area that serves you. And, governments have been allowing this in the name of it's supposed to drive costs down and on all this kind of stuff. I feel like when you talk to most physicians, at least in my experience, who are in this age, it's like they sold their practice, right, to one of these big groups. And now I feel like with your model, it's almost like the reverse, right? It's where, hey, let's move away from these big systems that are supposed to be driving costs down, but nobody I know is seeing lower costs in healthcare. So, can you tell me, like, in your perspective, this structural shift that has happened, and then where you see HIPnation and other types of, movements that are trying to bring patients back to the doctor, bring the doctor out of this massive monolith, and kind of show us where that's going and what the sustainable path is? Because, I mean, it seems like we should all be on this model, right? Like, why aren't we all on this model?
That's the goal. So your mouth to God's ears. So you're 100% correct, Zach. Right now we see this massive shift towards, hospital-based employment. Studies have shown, right? So they've looked at economic studies that have taken a look at consolidated marketplaces in the world of healthcare and found that these highly consolidated marketplaces that are coming about through these vertically integrated hospital systems are driving up costs. There was a study out of, I believe it was Northwestern, that showed a 22% increase in costs in highly consolidated marketplaces in healthcare, with perhaps even a decrease in the quality of care that's being delivered in them, right? So the data, which is not surprising, right? We see that out of any type of a monopsonization process, right? Cost goes up, the quality goes down, and we're seeing that in healthcare. And it's a shame. And the reason it's happening is simple, that hospitals are, right, just part of the system that is going. If I can aggregate and consolidate physicians, charge insurance companies more money, then I can create greater margins. They're buying up primary care doctors because a primary care physician brings a little over $2 million in revenue to hospitals through ancillary services, not through their E&M codes of seeing people, but from using the hospitals for their imaging centers, the ambulatory surgical centers, right? They're a revenue generator for the hospital, which is why they're buying them all up. And all that's doing, again, is driving up cost. which then is going to be driving up premiums. We can talk about how the insurance companies get paid because they're actually pretty happy to see higher costs in healthcare because they try to charge more premium. But we can talk about that if you like, about their business model. And I will tell you, when you talk to most physicians, you'll find that they go, I went into medicine because I want to take care of people and I want to focus on that. The burden just got too great, too expensive for me to do it. And so I tried to run to a place that I thought was comfortable. And we saw this in the early 90s with the consolidation in healthcare. Now, and at the hospital I thought was comfortable, now they're telling me to see more and more people, right? That's, I tell people in the hospital systems, you are what's called a revenue value unit. You're an RVU. So physicians get paid in the hospitals based on generating revenue value units, and the RVUs are people. And what I do to you generates an RVU. And so we've somehow turned, again, this into a process of, really an industrial complex as opposed to people taking care of people. So our goal becomes, while that's happening, let's start running the other direction. Let's create a platform and a place where people can be a physician again, be paid in a more efficient way, try to decrease some of the administrative burden and costs are associated with that. Let's try to start, if we can, right, steering this healthcare ecosystem one that has the opportunity for physicians to get away from that kind of administrative, bureaucratic, and complex, and step back into caring for people. And so part of, again, steering the Titanic, if you will, and giving people a place where they can actually really practice healthcare.
Yeah. Where do you see the place for a hospital system? If your model was able to propagate, over the next 20 years and became the dominant model in the United States, what role do you see the hospital? Because obviously there's certain things that only can happen there, right? If you're trying to rebalance how the system works, what would be your vision of how that worked and how people experienced in that?
Yeah, we're always going to need to see hospitals, right? That's always going to be a part of what we function in society. We have people that get tremendously sick. I was actually on call. I was in the hospital seeing somebody that was sick, this morning. And so we need a hospital system managing the locus where people need to be operated on, people have an acute medical condition, people have a significant cardiac event, people have to have a couple of days stays in the hospital. So they're always going to be, necessary, But right now, the fact that they're amalgamating ambulatory surgical centers, right, which are outpatient surgical centers, they're amalgamating physicians and pulling physicians up, imaging centers, right? They're pulling all of these revenue streams together, right? And increasing the cost of those makes no sense. And if they say, well, we have to do that, because we're not getting paid enough to take care of people in the hospital, then let's stop this cross subsidization. Let's create the transparency of why are you not getting paid enough for maybe a cardiac bypass surgery, or actually managing somebody that's in the hospital with a diverticulitis that's in the hospital for a week and not having a high revenue generating medical event in the hospital. Let's solve that problem. Let's not hide it by cross subsidizing it from taking ambulatory surgeries and doubling and tripling their cost to subsidize that, whereas we could sell that ambulatory surgery at a fraction of the price in a standalone outpatient surgical center owned by the general surgeon. Right? You're never going to solve the problem of hospital cost if you just hide it amongst, right, all of these other potential revenue streams. So I think it needs to be disaggregated. I think they need to be there, and we need to figure out how to make sure we get the proper funding to the hospitals to cover the care they want. And I will tell you, the hospitals, and I've say this, I've been engaged in hospitals, never sat on like the financial side of the hospitals, but just looking around, they are tremendously inefficient economically. And they get away with it, because of so much of the cross subsidization, because so much of the things that they're allowed to do based on, government regulations and tax freedom that they have, the monopolization. So I think they need to be there. We just got to find a way to make sure that they're getting paid for the work they're doing.
Yeah. All right. This has been so good, but we're running out of time. I would love to kind of focus back in on, we've talked about HIPnation. We've talked about, y'all's goal to really propagate this model. You said before that you're a physician. How did this come about? Why did you decide to start HIPnation instead of just sticking to being on call and seeing patients every day?
Yeah, no, thanks. So I love medicine. I wanted to be a doctor since I was 5 years old. It's just, It's one of those things that I just love it. And medicine's broken, and medicine's a mess, and medicine isn't delivering on the beauty of what it can do. And if you really like love taking care of people and you really love medicine, as anything that we see in our lives, right? If you love it, you go, I want to maximize it. I want to improve it. And so I just saw, and like I said, my colleagues, and we all know it, like we feel it in our guts, right? You're on this podcast, we all look around our society, we all know something's wrong in healthcare. And I've got a big mouth, and as you probably notice here, I talk quite a bit. And I was like, we just have to go fix this. So I initially engaged doing some work in think tanks and looking at think tanks and trying to evaluate and assess how we can maybe fix this broken healthcare system, and was just very blessed to meet some really talented and intelligent people that embedded themselves in me, and spend some time looking in the policy world and going, can we make change at the political level? And to your conversation that we had earlier, it was a brick wall. I tell people I felt like I was just beating my head against the wall and getting a bruised forehead. Like nothing was changing. And so we really had two choices, right? We could continue to complain and continue to try to yell and see if we can make a difference, or we could maybe go build something. And we opted to go build something. And so that our genesis was out of trying to make policy change to going, you know what, the person in the mirror is the one that I can count upon. It's the one I need to actually, yell at and tell them to go do something. And so, we're the ones standing in the mirror, and we said, let's go build it. And we loved it. It's been tough. It is hard. This is moving a really difficult entity, and people are stuck a little bit in the insurance world. They don't understand the chaos and I don't understand the why, but we feel like we're on the right track, and we're evangelists about a better way forward. Is just trying to get the marketplace to continue to realize that the system is built for the system and not for them.
Yeah. I really appreciate the work that you're doing. I love the vision that you're casting, and that you're not just casting, but you're actually building, which I think is amazing. So I really appreciate you coming on and sharing about HIPnation and about what you guys are doing. If for our audience, how could they connect with you guys? Where do you serve? How can people connect if they want to be a part of or join your membership, or an employer who wants to work with you all? How would they do that?
No, certainly. Thanks. So they can reach us at HIPnation.com. That's our website. You can come onto our website. If it's an employer or even an individual, they can request a quote, or they can contact our team. We're happy to reach out and connect, have conversations with people. Again, we're very white glove about making sure that we can walk people through the full understanding of how we work. And so whether it's an individual or a really small business owner, whether it's a company with a larger group, you can contact us at hipnation.com. You'll connect with a real human being that will talk with you. Our target is really focusing now in the kind of metro Atlanta marketplace. It's kind of where we were born. Now we have our tentacles spread throughout the Southeast. There is a revolution going on in healthcare. There's a lot of reciprocity of innovators and disruptors that are coming together going, how do we work together to help build things? So certainly they can feel free to reach out to us, hipnation.com, and then can continue a conversation.
If somebody's not in the Southeast, what would your recommendation be to, access? Are there other models like what y'all are doing? Or if they're just trying to get out of the rat race of the traditional insurance system, what would your suggestion be for them?
Yeah, so I would tell, if it's somebody that's in somewhere outside of the Southeast, and they're trying to get out of, like I said, an insurance-based model. Now, if they're an individual or a small business, I would tell them Google in their backyard direct primary care, and find a direct primary care physician near them. And if it's a really small business, then our co-op, and I'll put the name out here, that I use a group called Sedera. That's Sedera.
Yeah.
I'm on that myself. They're a medical cost sharing platform built by a physician. And so they can use that combination of a direct primary care and Sedera for that small group to kind of bring together as a product. If they're a business with a larger size business outside of the geography of the Southeast, I would tell them, feel free to reach out to us at hipnation.com. Our team, while it might be outside of our geography, we've got contacts and connections that we can always try to connect people with, maybe somebody in their backyard that is part of this innovative pathway, and the disruptors and the revolutionaries that are really trying to bring forward something better.
That's awesome. Well, thank you so much. Appreciate you coming on here and sharing your vision and sharing HIPnation with us. I hope that you have a great rest of your week.
No, thanks, Zach. I appreciate your time.